All right. Welcome. Good afternoon, everyone in the U.S. Pacific area. Good evening pala dito sa U.S. And good morning in the Philippines. Welcome to PT Meal Podcast Live Handaan. So what we're gonna do here in this usually like live segment for this handaan, we invite guests and we're gonna talk about certain topics in relation to physical therapy profession and practice. Tapos there, our guests would share some insights, experiences relating to said topic. Hi, lady. So, hi everyone who's watching. Um, if you're watching, kindly message kung saan kayo na nakikinig or you're watching from, and kindly share this stream to everyone so that we can reach more people and listen to our topic. So, last handaan natin, we talked about taking the transitional doctor of physical therapy in the Philippines. And that was an interesting discussion. So if you haven't watched that or listened to that, it's available in Spotify, Apple Podcast, kahit anong streaming apps that you're listening to. And it's also in Facebook and in YouTube. So we are now streaming in Facebook, in YouTube, and in Twitter. So yan, share nyo lang yung stream so that we can reach more people. Thank you, lady. All right. So without further ado, ang pag-uusapan natin this morning in the Philippines and evening dito sa US ay in celebration of June, Pride Month. So we're gonna talk about LGBTQIA plus issues and concerns relating to physical therapy profession and practice. So in context, the reason why we have to have this kind of conversation is because the LGBTQIA plus community is considered one of the marginalized sectors in healthcare, and there's certain social inequalities and health disparities that the community, the LGBT plus community is experiencing. So marami tayong topics na pwedeng pag-usapan, but we're just gonna focus on three topics kasi maraming issues eh. So just for brevity and conciseness, yun lang muna tayo, mag-focus lang muna tayo sa three topics which are, we'll talk about discrimination or differential treatment amongst physical therapists in the community. Next would be health concerns of LGBT plus members in relation to getting physical therapy treatment. And lastly, competency of physical therapists or physical therapy students with relation to the LGBTQIA plus needs and concerns. So, haba, no? I want to intro. Uh, so let me welcome my guests. All right. So let's start with Phil Dumaligan. He's a physical therapist, double board certified clinical specialist in geriatric and neurologic physical therapy, and he has been working in acute care setting for more than 5 years now. He's not new to the show. He has been a guest here. Hi, Phil. Welcome to the podcast again.
Hi, good morning in the Philippines. Good evening here and for the listeners in the US.
Yan. All right. So next would be nasa na yung kodigo ko. All right. Next is Regina Araquel, a proud LGBTQIA plus and currently physical therapist in New York City. She practiced clinically in various settings for 11 years in a multitude of cultures, both in the Philippines and in the US. She's working in a psychological and mental strategies in therapy with New York City health advocates, psychologists, and mental wellness coaches in healthcare. Um, Welcome to the podcast, Reg.
Hi. Hello to everyone who's watching.
Ayun. And last but not the least, ayan, medyo nagbabakel na ako. So, Jewels Racho is a trans woman who prides herself with her job as a physical therapist, her family and friends who love her and accept her for who she is and her faith in God's creation. She's a Filipino PT who migrated in the US 10 years ago and have 15 years of experience as a PT and specializes in geriatric population. Jules, welcome to the podcast.
Hi, welcome to the podcast. Good morning, Philippines. Good evening, USA. Hello, world.
Hello world. Yeah, parang PBB lang.
Correct.
All right. Someone's saying hello. Winnie Del Mundo. Hi daw, Reg.
Oh,
So yun. So welcome to the show. So we're gonna talk about some of, as I mentioned, some of the topics or issues that the LGBTQIA plus community is experiencing. Before that, baka meron kayong gustong i-share as an opening about our topics before we go to the specific topics na pag-usapan natin. Wala, wala naman.
wala naman.
Opening statement. Statement. Okay. All right. So, sige, let's start with our first topic, which is yung discrimination. Discrimination in practice. So, I'd like you to think of your experience, probably here in the US or in the Philippines, that an instance where you were, treated differently or discriminated outright by a colleague, a patient, or a family member because of your gender identity or expression or your sexual orientation, and how were you able to handle that treatment from that interaction. So kung wala naman, then good. Probably something that good experience that you had with those people. Sige, probably we'll start with Phil.
Wow.
Ah,
Yeah. I think I had that same experience
oh.
starting here in the US.
Mm-hmm.
Um, I used to work in Oregon, the border of Oregon and Idaho, the northeastern part. So it's a little bit different than the western side where Portland is. So I think it was like on my third month.
Mm-hmm.
I was doing home health at that time, and I had an experience where I did the start of care for the patient, and then it was pretty typical, pretty standard start of care. Nothing was said, there's no feedback. But when I went back to the office, they called the office. So my manager had to talk to me and ask me what I did wrong. Like, was there, did I do anything that I felt was wrong? Because the patient is now canceling our services because I did the start of care. And I said nothing. They didn't give me any bad feedback. And then my manager, I was there in the office, and my manager was probing, like, is there any instance where you felt harassed? Was there any instance where you feel like you were untreated unprofessionally by your therapist? And then the patient said, no. I just think that your PT is, he used the word FAG. I don't want to say that word.
Oh.
Um, derogatory.
Mm-hmm.
So he said, because of it, he doesn't want to have home health PT services anymore.
Mhm.
Fortunately, we were the only agency within 50 miles, I think. So asked to be seen by us because he had PT orders. So he finally he asked to be seen by a therapist. I had a PTA at that time, so the PTA was doing the treatment. Was that me?
You're kind of breaking up a little bit. Yeah.
Okay, am I chopped? Okay. But that was my first instance where it was very, very awkward because my services as a physical therapist was being refused because of my identity, my gender identity, and not because of my skills and my competence as a physical therapist. It was very heartbreaking at that time. But I just handled it professionally. I was like, I'm going to show up to this person's house in my PTA, do the treatments, do the evaluation, and then get out of there. Patient got better, discharged from the services, but it just left a bitter taste in my mouth. And it was just very, very eye-opening to me that in America, there's different types of America. There's not only one type of America. The America that we see in California, the America we see in New York, America that we see maybe in Austin, Texas is different from, the America we see in other parts. So that taste of discrimination here in the U.S.
Right. Yeah, because like we would imagine like that America is since it's a progressive country would imagine that there's not much discrimination coming here, but there are conservative U.S. conservative patients as well that can So yeah, sorry to hear that. So what happened? What? How did your supervisor supported you uh, during that time? Like when he heard about that, or when your supervisor heard
I
about it?
don't think I was supported, to be honest, because just me being in the same room, hearing that conversation, hearing what was being said about me, that was not great, to be honest.
Mhm.
And then actually after that incident, my supervisor was like, "Oh, maybe you should start wearing baggy pants," or
Sorry, you're breaking. Broke up.
I very animated when I talk. I'm effeminate. Maybe I think I'm effeminate. I'm proud of my feminine side. I identify as non-binary, genderqueer, by the way. So I'm proud of that side of me. I don't want to not show that side of me. That's part of who I am.
Right.
So I'm not going to force myself on you. I'm not going to force my beliefs on you. But this is me. I'm going to provide my services as a physical therapist, professionally, as professional as I can. And I'm providing excellent services. My goal is not standard service, but it's not affected by my gender expression or gender identity. But yeah, I don't feel like I was very supported at that time. In that
Um,
instance.
what would have been a good turnout for you had your supervisor been more supportive? I don't probably an ideal reaction, or what would you have expected a supervisor to act in those instances?
I think just probably educating the patient, say, hey, we don't use that word. That's a derogatory word. She can say, like, we do not see our employee based on his, we don't categorize them based on their gender identity. Their excellence is not predicated on their gender expression or gender identity.
Right.
Like, oh yeah, that's Phil, that's our physical therapist. He provides excellent services to our patient. And I don't think him being who he is, he doesn't have to say who I am in terms of how I express myself.
Right.
But she could have said, like, it does affect the services that he provides. So just having that, just reassuring the patient that, hey, even if you think he is like that, then he can still provide the service that's appropriate for you and that you deserve.
Right.
Just having that confirmation, that affirmation actually from my supervisor would have helped. And also the education provided to that patient would also help me in our community.
Right. And moving forward as well for future patients patient interactions like that. No. Okay. Yeah. It's sometimes mas not tolerate like if we are backed up or by our supervisor or by our employers. No, that would make it a little bit better somehow. Tama ba?
I
Can you say?
agree. I think
Mm.
we need allies like you. Like, I appreciate you, straight allies like you and other people advocating for our community, because at the end of the day, um, we need acceptance from all people on the gender spectrum, not just from LGBTQI, um, people who identify as LGBTQI, but also the allies are
Right.
very, very important. So thank you for hosting this podcast.
Right. So hopefully, like, this could like open up an you know conversation, especially with our colleagues in the Philippines. With I feel that yung ganong conversation mas maraming mapag-uusapan kasi dito medyo nag-start na with trainings and stuff like with orientation, pero I didn't feel anything like that in the Philippines when we were working. So I feel that I hope this starts a conversation. This starts an interest in research as well in the LGBTQIA plus community and the physical therapy practice, not just in treatment but also in patient care and therapeutic alliance between the patients and also education and training as well. Yeah. So thank you, Phil, for sharing that. Let's ask Jules. Any experience, being treated differently or some discrimination?
Yeah, I I have had that experience as well. I remember when I was working in Texas, I had this patient. This was before the transition. So back then, maybe I was like Phil, flamboyant, effeminate, very, you know, very girly when treating a patient. She loved me. That particular patient did love me so much. Until one day I called out, and then my physical therapy assistant saw that patient, and then she asked the patient asked the assistant um, about me, and the assistant told her that I wasn't actually a woman, that I'm actually, just a gay guy. And then when I came back to work the following day, the patient um, did not want me as her physical therapist anymore. And I felt like, what did I do? And again, this was before transition. It's not like I told her that I'm a woman. There was no conversation, no nothing like that. Um, I was just treating her. I'm her PT, she's my patient, period. And then she was just so upset to find out that I'm not a woman, that I was actually just a guy. And yeah, that was very upsetting on my end. I felt like, what did I do wrong? I was doing good. I was seeing you. You were improving. You were getting better. We had a very good relationship. So regardless of if I'm gay or trans or a woman, why should that matter, right? But yeah, I wish that my supervisor could have talked to that patient, like, hey, Jules is doing a good job. You're improving. You came here. You're not able to walk, and now you are walking with a walker. Like, what's wrong with that? But yeah, nothing like that happened back then. Um, but you know what? Instead of being discouraged, that particular incident made me transition because that patient told to the physical therapy assistant that she thought I was a woman because of my voice, because I was talking like so effeminately. And then it came to my mind like, hey, I really cannot change the way I speak because this is how I talk. I feel like I have such a very feminine voice that people would have mistaken me as a woman. Even on the phone, when they call me back, they would alert me that something is trying to access my bank account, and I'll be like, that's me. So instead of changing my voice, like, instead of portraying that I have a big, deep voice just so it would fit my physical look, I just changed my physical look. And from then on, I did transition. So I used that particular experience on my advantage. And looking back now, it was upsetting, but if not because of that, I would have not been here. That's it.
Okay. Well, I lady said you're a gorgeous girl. All right.
Thank you.
Yeah. Yeah. So, pero for di ba, it's somewhat parang for me it's somewhat hard if a patient suddenly like changes their mind, tapos you're gonna come back and face them again, right? How
Oh
was
yeah, it
how,
is.
uh,
It was. And no, that patient was not assigned to me anymore. That patient was assigned to somebody else. So
uh,
I didn't have to deal with her. Although
okay.
it will be awkward to see her in rehab room, in the
Mm,
gym. I'd be like, okay, there she is. And
mm.
she called me her granddaughter for a while. I
Oh,
thought it was just a term of endearment,
right.
but yeah, apparently she was thinking that I was really a woman.
Uh,
I would share one more experience, but this is a patient who is a Muslim.
mhm,
And then I saw the patient a number of visits, and then all of a sudden they called the office to request for a new therapist. But in this particular scenario, like, I totally understand. It's
mhm,
very, it's related to their religious belief.
uh,
So I just did not say anything. I was like, I fully respect that.
mhm,
If that's their belief, I would not argue.
mhm,
It's not about me as a professional or as a physical therapist. It's
mhm,
just what they believe. And, let's leave it at that.
uh,
Yeah. And at this time, if I would have people discriminating me or they would choose another physical therapist because they don't want me because of my gender,
mhm.
I just move on.
Okay.
I
Yeah.
just don't deal with that anymore. Like, you do you. I'm
Mhm,
not doing anything wrong. I am helping you, but if you are gonna judge me
mhm.
because I'm a trans woman, like, it's not on me, you
Right.
know. You do whatever you want. I'm trying to help you, but if you don't want my help, then so be it.
Right. And no one can force you to see that those kinds of patients too.
Yeah, and if I feel like discriminated at a patient's home, even before they call the office, I would call my office and
Mhm.
ask for reassignment.
Okay.
I
Yeah.
would just tell them I'm not comfortable going back to that patient's home.
That's good. Yeah.
Yeah.
All right. Yeah, that's another issue. Yeah, big issue. Religion and preference. Yeah. Pag binuksan natin yung mahaba-habang issue yan. Mahabang discussion pag
Yeah.
binuksan natin
Mm-hmm.
ng religion eh. So stick na lang muna tayo dito sa natin nating topics. But thank you for sharing that. I
Okay.
y- um yung patient mo kanina na you mentioned, was there any sign of remorse or was she aware that that was something that was not appropriate of her to, you know, ask?
Um, I I don't think so. But
Uh,
again, this is Texas. This is an older
okay.
patient, and
Uh,
yeah, sometimes you really cannot teach old dogs new tricks. It's hard for them to understand how we are now. The diversity, gender preferences. So I just really just let it go, and that helps a lot. Just letting go.
okay. Right. But you try to find a balance to educate and just like move on.
Yes.
Yeah. Okay. Yeah. Thank you for sharing. Reg, your turn. Oh, sorry. I muted you. Yeah, you can go now.
Ayan. Okay. So, ano yung una nating ano?
Um. Uh. Different treatment or discrimination. Any
Ah,
experience with that?
from the Philippines, kasi nag-start ako mag-practice sa Philippines pa lang.
Mm-hmm.
Nag-home care ako, nag-outpatient ako, and even sa internship, kasi I identify as a lesbian.
Mm-hmm.
So, may time na may face ako na kahit lesbian ako, mahaba yung hair ko, and may face din ako na nagpapagupit ako ng short hair.
Mm-hmm.
Sa Pilipinas, the most common thing ng mga taong nagdi-discriminate is, oh, andito na yung PT mo. Si ate or si kuya ba to? Ate ka ba or kuya? Gaganunin ka. Or sir ka or ma'am? Ginaganon ka. So, ang excuse lagi sa atin kasi, gino-joke lang kita.
Mm-hmm.
Or, maski sa family, sabihin na gino-joke lang kita. Pero, they don't know, it's offensive.
Right.
Like, okay, sinabi ko ba na kuya ako? Or sinabi ko ba na ate ako? Bakit ina-assume mo, di ba?
Mm-hmm.
Parang, hi, ako yung PT, period. Di ba?
Mm-hmm.
So, sa Pilipinas usually ganun. Or meron akong naging patient sa Pilipinas, of course yung older population, hindi sila masyadong oriented sa okay, lesbian to. Para sa kanila, tomboy ka lang or bakla ka.
Walang
That's it.
filter minsan din.
Walang filter talaga. Ano sabihin? Parang tomboy yata yung therapist ni mama. Parang ganun. So parang ako, okay. Ako pa rin yung therapist. Parang ganun. So, parang na-judge ka nga muna yung image mo, hindi yung nagagawa mo. Pero after naman nun, like, gumaling yung mom niya or gumaling yung patient mo, then they're very grateful. Pero, kailangan mo pa ba talagang pagdaanan lahat yun, di ba?
Right.
Dahil lang yung mga tao, wala, kailangan lang talaga i-categorize ka nila. Kailangan lang alam nila kung babae ka or lalaki ka or kung ano man. And then, pagdating ko dito sa Amerika, my first job was in Kentucky, as in southeastern Appalachia, Kentucky.
Ooh,
Talagang
Kentucky.
deep south.
Uh-huh.
So the town I was in, it was about 1,000 people population. You know, most of them are older people. So yung younger colleagues ko, they were fine. Like, immediately was brought up na, oh, Regina, are you married? Or Regina, do you have a boyfriend? Are you living with someone here? Because you don't know anybody in our town, whatever. Sinasabi ko, no, I don't know anybody. And I'm not married. Then we have to find you a man suitable for you, blah, blah, blah. And I said, I'm so sorry, I'm not looking for a man because if I'm going to be with somebody, that would be a woman. So sa kanila, parang, shock yun. Parang, oh, you want a woman? Ganun lagi yung... So, pag older population, usually ganun. There's shock. Pero yung younger colleagues ko, they're like, oh yeah, we're gonna find you a girl here. Doesn't mean that we're Southern, that we can't find you a girl. Maybe a girl here likes another girl. You never know. Or, meron namang times na yung colleagues ko, magjo-joke na, for example, meron kami kailangan i-repair sa office or whatever, tapos ni-repair nung kasama namin na lalaki, ganyan. Okay, Regina, that's why you need a man in your life. You see? They're handy for something. Ganon. So parang ako, okay, hindi naman porket lalaki siya lang makakagawa niyan. Parang kaya rin naman namin gawin niyan. Okay. Tapos, pag naman sa patients, ganun pa rin. Yung matatanda pa rin yung, so are you here with a feller? Are you here with a man? Lagi na lang yung identity mo is in relation to meron ka bang asawa na lalaki. Like, sino yung kasama mo sa bahay? And pag sinagot ko na, no, I'm not with any man, I'm not married, laging kailangan ka naming hanapan ng lalaki. Ganon yung orientation nila. Well, I guess kasi Southern or whatever. Tapos, meron akong PTA na sinabihan talaga ako, why do you like women? Tapos sabi ko, if I knew the answer, believe me, I would tell you. Tapos sabi niya, no, I just asked that because, you know, it's a sin. Nagad yung entra niya sa akin. Tapos parang ako, sabi ko, I don't think we're here at work to talk about this. I think we're here at work to work. Sabi ko ganun. So ginaganon ko na lang. Ganun ko hinahandle. Like, ayoko maging mean na parang, that's none of your business or whatever. Although some people would prefer to be stern and say, that's none of your business, I'm so sorry. Ako usually parang, okay, ayoko naman masira yung working relationship natin na hindi tayo magpapansinan. So I just say, no, you know what? We're here to work. Let's not talk about that. That's not, you know, that's not open for discussion. That's not on the table. So, and then nung lumipat ako sa New York, I was thinking, oh, mas liberal ang New York. Super liberal ng New York.
City,
yeah, it's New York City. Maraming tao dito. And, you know, I think they'd be more open to gay people. Yeah, the largest gay population in America is in New York City. So, nag-home care muna ako. And yung home care, nakakatawa kasi yung home care assignment ko is in South Brooklyn, which is heavily Orthodox Jewish. So, this is literally the Jewish people na talagang, yeah, homosexuals don't even exist in their community. You know? So, ngayon, in Jewish culture, sa religion nila, pag babae yung patient, babae lang yung pwede mag-treat. Pag lalaki yung patient, lalaki lang yung pwede mag-treat. So separate yung ano. Sa outpatient, ganun din. Nagtrabaho din ako sa Jewish centers na outpatient. Separate talaga yung babae at lalaki. So, nung nasa outpatient, papasok ako dun sa room ng patient na babae, and immediately, pipigilan ako. Like, no, I requested a woman. Na I have to clarify, no, I am a woman.
Mhm.
And then, sasabihin sa akin ng pasyente, well, you sure don't look like one.
Wow.
Sasabihin sa akin, why do you dress that way?
Uh-huh.
I think you have to dress more like a woman. Ginaganon pa ako.
Uh-huh. So how do you handle that?
So parang ako, well, I don't think that affects my capacity as your therapist, the way I dress. So,
Mhm.
but if you want another therapist, I will go outside. I will call somebody else to be with you. Ganon.
Mhm.
But after that, like, mabait naman na tao na, no, I'm sorry. Like, I didn't mean to offend you. I just thought you were a man when you came in and we can't really see men. Ganyan. So, para sa akin, okay. Ibang story naman kapag home health. Pag home health, pupunta ka sa bahay nila.
Right.
So, kakatok ka pa lang, of course, magsa-schedule ka sa phone. Yung babae yung boses ko sa phone. So, hindi naman nila may tsura ko. Pag nag-appear na ako sa doorstep nila, sabihin nila, who are you? Sabihin ko, I'm your therapist. Oh, we were talking to a female therapist. And sabihin ko, yes, that's me.
Uh-huh.
Sabihin nila, oh, because you don't look like a woman. Laging ganon. Laging may you don't look like a woman. And ang ano nila is, meron pang Jewish patients na nagsasabi sa akin na, well, God ultimately created only man and a woman.
Mhm.
So I don't know about all of these modern people who think that they can be with a woman and a woman and a man and a man. Parang may lecture pa. It's
Right.
exhausting because you have to hear, like, in my whole career, and I've been a PT since 2011. In my whole career, I have always had to deal with people saying, you don't look like a woman. Why don't you dress like this? Why do you look like a man? Why did you cut your hair so short? I even have patients, ito yung pinaka-shocking sa akin. This is in Manhattan. Manhattan to me is supposed to be like, okay, it's metropolis. Everyone's supposed to be liberal here.
Mhm.
Meron akong patients na they're very appreciative after the therapy. Like, oh my God, I don't know what you did. I feel amazing after, blah, 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 blah. I wonder who goes home with you.
Oh.
Like, oh my God, I wonder who goes home with you, and he must be a very lucky guy. Ganito yung tsura ko, ah.
Mhm.
Ito yung haircut ko. Ito yung damit ko. And sabi sa akin, he's a very lucky guy. Like, don't ever let go of that guy. He should keep you, whatever. It's parang ako, hindi ko naman kailangan i-disclose sa'yo na babae yung gusto ko or that I go home with a woman or may girlfriend ako sa bahay, whatever. Sinabihan pa ako ng, sabi ko, oh no, I don't have anybody. Sabi ko ganun. Sinabihan pa ako ng, I'm gonna give you a tip. If you want to have a man in your life, I think you should grow your hair. Men love long hair. Ganun pa. So parang ako, hindi ko alam yung reaction ko at that specific time. Kasi parang on the spot,
Right.
ma-offend ba ako? Ang hirap kapag naipit ka na sa ganun. Kasi pasyente mo yan, okay, natuwa siya sa'yo. Siguro well-meaning naman siya, hindi niya alam na lesbian ka or wala siya siguro talagang idea, I guess.
Mhm.
So, di na lang nag-comment. Parang ako, okay, yeah, I suppose men love long hair. Okay.
Uh-huh.
Ganun na lang. Parang, usually hindi na ako nag-e-effort.
Mhm.
Kasi, lalo na pag nakikita ko na yung kausap ko is super attached na siya dun sa idea niya of ano yung babae and lalaki, and alam ko naman na hindi siya magiging open kapag narinig niya yung idea, or tatagal lang yung session and kailangan ko na i-cut kasi may pasyente pa ako. Of course, hindi ko sasayakan yung oras ko kasi billable time yun.
Time yan. True.
So, exactly. So, ganun ko hinahandle. Parang sasabihin, either tatawa ko pag may time ako i-educate ko, or halimbawa sabihin sa akin joke lang ngayon, sasabihin ko minsan na, it's not a nice joke. Gagawin ko. So, there are different ways. Pero the sad part is that as a gay person, kailangan mong pagdaanan yun every single time.
Mhm.
I mean, sabi ko sa'yo kanina nung before the show started na swerte yung mga femmes or swerte yung mga gay guys that they really look like guys kasi hindi ka natitirahin agad dun sa itsura mo.
Mhm.
Like ang femme na lesbian, wala na magko-comment. Mukha siyang babae eh. If anything, the guy will hit on her. Diba? Pero ako, because I don't look feminine, laging merong comment sa itsura ko. You have no idea how many times I've had to answer to how I look like.
Mhm.
Diba? Parang ang exhausting nun, which a straight person will never have to deal with in their life, is kailangan mo i-explain yung appearance mo. And kailangan mo tumanggap ng comments. So, ano dapat yung itsura mo dahil babae ka? Or
Mhm.
kailangan mo laging explain na, ay, hindi lalaki yung gusto ko. Parang
Mhm.
gano'n. Ang swerte nung, in that aspect, swerte yung mga straight therapists.
Aha.
Kasi, hindi ka tatanggihan kasi mukha ka ng lalaki or babae. Wala na ko questionin sa'yo. Wala lahat nitong hassle na to.
Mhm.
Dahil lang straight kayo. Parang gano'n.
I think medyo mahirap din minsan yung parang I don't know, tell me kung totoo. You try to balance not explaining your gender identity expression and just like letting it go, as to, explaining it, this is me, this is who I am, and stuff like that, that this it does not affect my, parang kind of taxing talaga, no? with
Mhm.
with with all the explaining and juggling kung ano talaga yung kailangan mong sabihin, ano yung kailangan mong, parang sometimes you have to like be in a closet ba para babalik ka pa sa closet, or
Mhm.
sasabihin mo ba sa kanila, or just gonna let it go.
Kasi hinahalo nila yung professionalism with our personal life.
Right.
It doesn't affect, I mean, the being a therapist does not affect my personal life, just as my personal life does not affect my being a therapist.
Mhm.
Pero can you imagine, we're only talking right now about yung professional career.
Right.
Can you imagine, in our daily lives, simula nalaman namin na gay kami, kailangan namin i-explain to sa lahat ng aspect ng buhay namin. Ganun siya kahirap.
Mhm.
Hindi lang siya sa working na explain.
Uh,
Pag pumunta ka, pinakilala ka sa bagong tao, pag may pinuntahan kang event, kapag may nakilala kang ganito, anything that we have to do as a gay person, lalo na kung nasa Pilipinas ka, kailangan mo laging i-explain yung sarili mo, bakit ganito yung itsura mo, gusto mo ng babae, ganyan. Do you imagine how exhausting that is?
Mhm. Right. Same
Diba?
same
Parang,
din ba ang sentiments mo, Jules?
Yeah, in some parts,
Or
but you know what? For me, I really don't discuss anything about my,
yeah.
gender preference, my
Right.
sexuality, any to
Mhm.
my patients, neither to my coworkers.
Mhm.
I don't have to.
Right.
I've
yeah.
had a patient ask me one time if I'm a trans woman. It's not that I'm not proud to be. I am really 100% proud to be trans. It's just that I did not come here to talk about me.
Mhm.
Mm.
And I would just dismiss the conversation and I would just say, if you want to ask me questions that's physical therapy related, that's, related to your case, I would definitely be happy to answer it for you. But
Mhm.
that question about me is
Mhm.
not what I came here for. So
Okay.
I would prefer that we not talk about it.
Yeah.
Mhm.
And they would respect it.
That's good.
I guess because again, like what Regina was saying, it could be too taxing. It will be tiring to explain to everyone why you like women, why you like men. And you know what I learned? Just the fact whenever they ask me, so do you have a husband? I dismiss that already because I know from that question will lead to
Branch out.
To
another
another.
and
Yeah,
to
yeah, yeah.
another and to another. So I just dismiss that right away. Like I would just say, nope, I don't have a husband and I don't want to talk about myself right now. I'm so sorry. It's physical therapy time. It's time to do your physical therapy. So let's start.
Mhm.
I just do that. Like, nope, we're not gonna discuss about me. And I just learned that, from the practice. Now in the Philippines, it's a different situation. I have not been a physical therapist in the Philippines as a
Mhm.
trans woman,
Mhm.
so I would not be able to impart any experience on that.
Uh, but that's good. You set parang sa simula pa lang you set boundaries eh.
Yes,
This
they
is
do.
our therapeutic relation. I'm here for you, and we're not gonna talk about me. We're gonna talk about you and how I can help you. Yeah,
Correct.
that's
Yeah.
a good one. All right.
Yeah.
So I think medyo na nawala si Phil. Baka bumalik siya anytime like soon. Um, we're gonna move on to the next topic, which is well, that was a good discussion. Thank you for sharing that. So next would be the health concerns of the LGBTQIA plus community in terms of physical therapy. So in your practice, what are or in your like friends or in your circle, what are the health issues or concerns that the community is experiencing that is sometimes overlooked or neglected in our practice? Kasi I know um, for chance I've read somewhere that they sometimes they don't get that um, access to healthcare, like especially for affirming surgeries, post affirming surgery. So minsan di daw sila nagkakaroon ng access to that. So for in your experience, ano yung mga health concerns or welcome back, Phil. So we're moving on to the next question. So ano yung mga LGBTQIA plus health concerns of the community that is sometimes neglected or overlooked in our practice? Let's probably start with Jules.
Um, I don't know. What the example that you were saying?
Uh-huh.
I think that has improved
That has improved. Okay, that's
nowadays.
good.
Like, yeah, a lot of insurance companies now do approve gender reaffirming services for trans women, as
Mm-hmm.
long as you can provide a letter from a psychologist or from your doctor's office
Mm-hmm.
that you are really transitioning to become a woman.
Mm-hmm.
Of course, there are certain requirements to get approved, and I think one of the requirements is that you should be taking hormones for at least 12 months.
Right.
That's one. And then that letter from a psychologist or from the social worker from your team, and then those get submitted to your insurance company, and most of the time they approve it.
Mm-hmm.
I live in Philadelphia, so I would say when it comes to PrEP or pre-exposure prophylaxis, it is very accessible in my city. You can access that for free. We have a local LGBTQIA clinic that provides free STD, HIV testings, and they would also provide free PrEP
Mm-hmm.
for patients who want it and need it.
Right. Okay. That's good. It's good to hear that in your experience it's improving already. Uh, Reg, any experience in healthcare delivery or specific health conditions that the community is somewhat being neglected on?
For New York City, well, definitely very accessible
Mm-hmm.
yung gender affirming procedures.
Mm-hmm.
Um, I think when you go out, it's not really the cities that we're talking about here because the city is definitely very inclusive. When you go out of the cities, then a lot of LGBTQIA people are having trouble finding doctors who support them.
Oh.
Kasi you need medical necessity to access these services.
Mm-hmm.
The doctor has to write that it's medically necessary for your insurance to even consider
So
approving you. So there are so many people outside of the cities, definitely, that are very underserved and they are suffering. And there's so many documentaries actually na pwede mo makita na wala talaga silang access to hormones,
mm-hmm.
procedures, even like yung aftercare, after surgery. Like I have had a few na after ng gender affirming surgeries nila, they need therapy, di ba?
Right.
Kasi especially bottom surgeries, yan, the hardest cases siguro na nakita ko bottom surgery kasi ang hirap bumalik sa ano nila sa function nila. So, um, in New York City, yes, very progressive.
Mhm.
They are covered. We see them, but outside of New York City, and I do know a few people na na-meet ko lang through friends and through work na nag-travel sila to New York City because wala silang mahanap in Ohio, wala
Mhm.
silang mahanap in Tennessee, wala
Mhm.
silang mahanap in Virginia, parang ganun.
Like mahanap
So,
na healthcare professional
healthcare
specifically
professional,
catering.
yes,
Mhm.
yes. There is always an OBGYN, there is always a urologist, there's always a GP, but someone who would believe you that you need to transition and someone who will write that it's medically necessary for you is not easily accessible to people outside cities, big cities.
Mhm.
So there's still a long way to go pagdating sa
Mhm.
ganyan. And
Right.
in terms of sa Pilipinas, don't even ask.
Mhm.
I
Right.
don't think we're close to that at all.
Right. I think even with inclusive wordings in our documentation sa Philippines,
Yeah.
hindi siya ganun ka-inclusive. Like I know in New York City, they have listed 59 genders.
59 genders.
So may ano
Exactly.
talaga. So like inclusive talaga. But if you
76 na siya ngayon
76 na ba?
actually.
Oh, okay. So
76
yun.
na yung genders.
So that kind of shows that you're really intentional and
Yeah.
including everyone. Sa ganun pala with simple as documentation. No? How about you, Phil? Anything on that topic? Um, access to healthcare, conditions of members of the community that are somewhat neglected in our practice.
I live in I work in San Francisco, California. I live in the Bay Area, so I would say I'm fortunate to have seen services that are equally inclusive to all genders. Where I work for the University of California, San Francisco. Um, there is a section wherein a patient can choose their pronouns. So when we greet our patients, we greet them by their pronouns. Or we're required to ask them, "So what's your preferred pronoun?" Because I work in acute care, we have patients who identify as trans men or women, and they're probably in the process of transitioning. So they are not affirmed in terms of looks. They have not gone through the surgeries that will affirm their looks or affirm their body. So it's hard to tell when you're looking at them, but when you look at the chart and you see their preferred pronouns, then you can actually address them appropriately. So I like that where I work, and as employees, we are required to put our pronouns, or maybe encouraged to put our pronouns on our emails. So I actually have a section where I put my pronouns. It's her, he, she, which are my preferred pronouns. I also work for Kaiser, and I know that they do speech and language pathology services for voice for patients who are in the process of transitioning to help them achieve the voice that they want after they do the gender affirming surgeries. So that was very beautiful to watch. It's actually led by a guy who identifies as a member of the LGBTQI community. It's very beautiful. He's actually an awesome guy. And then also, I think something that's neglected for men's or women's
Naputol, naputol na.
Medyo nag-jump
even
Medyo na ano na siya.
na Nikki
Na,
Nine ng bandwidth.
sige na yan.
Ayan, hi Phil.
he's
Welcome back.
Yeah, welcome back.
sorry.
We're cut off.
Sorry. Um, yeah, so I'm actually fortunate that I've seen this. I actually want to let the other PTs know that the APTA is actually pushing for more gender for diversity, equality, and inclusion in education. So in our residency program, we have acute care residency and neurologic residencies for PTs. They're required to go through modules recommended by the APTA to make sure that they're providing care that is inclusive and respectful of all genders, cultures as well, and beliefs. So I'm very proud that my workplace is in the forefront of making sure that we have equal access to healthcare.
That's good. That's good. Yun na nga talaga, I think it would be the drive for our practice is being inclusive. So in you know, coming from that inclusion na topic is how would we, ito na yung third topic natin, third year talking point is how can we um what do you call this, exercise gender sensitivity and inclusion in our practice? Should it start from sa practice na mismo or kailangan masimulan natin siya sa school? Kasi I don't remember studying anything on that except on back then it was reassignment surgery but now it's affirming surgery, di ba? So yun lang ang naalala kong topic back then na napag-usapan. Pero for you, in your opinion, where should that start? Should it start from na sa practice na dealing with patients, or should we start at school? Let's start with Reg.
I think definitely sa school.
Mm-hmm.
You should start teaching your future PTs that this is one of, just as you're teaching PTs different cases, ortho cases, neuro cases, this is also a case. Kasi you will see this more and more, I believe. Um, there should there should be enough time to cover gender affirmed patients. How do you deal with them? Like kung tayo we see patients may ACL, may hip replacement, knee replacement, may phases of recovery, may phases of kung ano yung bibigay mo sa kanila at a specific time,
Mm-hmm.
then I think it's we need to learn like if somebody had gender affirming surgery, what are the phases that they go through, di ba? What do you need to work um, with regards to their movement, their function, and then how do you integrate your treatment with OT, speech therapists, like yung sinabi ni Phil, di ba merong mga nagsi-speech therapy pa for after gender affirming surgeries. I think it's necessary now na sa school siya mag-start. Kasi otherwise, when you come into, like tayo, we didn't get that, but coming into the practice, these younger kids graduating, when they come into the practice and they see na, oh, this is a type of patient that we have. And I know I remember in the Philippines, di ba, very limited din yung cases. We don't see all the cases in the Philippines. We don't even see a lot of like Alzheimer's. We don't see a lot of like cancer patients getting therapy. Dito mo talaga sa Amerika makikita. I think now is the time to start yung curriculum should be adjusted into what we will really need to expect in clinical practice once you're out there in wherever kahit saan country ka mapunta. These are the same people that you will see. Kailangan sa training mo pa lang equipped ka na.
All right. So, ikaw naman, Jules, like how can a physical therapist become an ally in dealing with members of the LGBTQ community?
I guess I'd say, no, first and foremost, respect the pronouns,
Mm-hmm.
regardless of your colleague or your patient. Like, I know for some it could be really very awkward
Mm-hmm.
to ask for a person's pronoun, but you can start by saying, "Hi, my name is Jules. I'm a physical therapist. My pronouns are
Mm-hmm.
she and her. How about you?"
Mm-hmm.
Because that, especially if you're confused, if you're dealing with somebody, maybe like Regina, like I don't know, the name's Regina, but I'm seeing someone who presents themselves like a guy. I don't know what pronouns they would prefer. You can start the conversation by something like that.
Mm-hmm.
You start by introducing yourself and then ask them.
Mm-hmm.
And that way you would already feel that you're inclusive, that you are respecting them.
Right.
Start with that one.
Mm-hmm.
I think that's number one. And number two, with our colleagues and our patients, I'd say tolerance, you know. I'm lucky that most of my patients really see me as their physical therapist. I'd say 99% of the time.
Mm-hmm.
And I always set that boundary that I am your physical therapist, you are my patient, we are not friends.
Mm-hmm.
Like, I would establish a good rapport, but there's a boundary.
Mm-hmm.
Yes, I do that. And um, I guess in our profession, we should always have that boundary as well.
Mm-hmm.
Because when a patient sees you as their therapist or someone who's professional or someone's there to help them,
Mm-hmm.
they would not dare cross that boundary because they will respect you.
Yeah.
They will respect you because you're a good therapist. So they would realize that regardless of your gender preference, you could be trans, lesbian, or gay,
Mm-hmm.
they would realize that you're there to help them and that you are capable of doing your job and
Mm-hmm.
practicing your profession. And then from then, the conversation would just stop. Do not let your patient close their doors to you because of your gender preference or, you know,
Like,
sexual preference. Just
mm-hmm.
show them what you can do and, they'd
Mm-hmm.
appreciate it.
Right, right. That's good. That's good. And Phil, same. How can our colleagues or us as physical therapists, our profession, move forward into including to be more inclusive in our practice?
I think education is important.
Mm-hmm.
Educate them early, educate them at school. Um, I think that now there's a big push to require gender sensitivity training in the school before physical will enter the workforce. I know that I'm working with students right now, and they're saying that they were required at
Okay,
school,
good.
but Californian students. They're required at school to go through gender sensitivity training before they go through their internships. So that's a win for me. Um, and education, um, our part is very, very important because we educate our colleagues, we educate our patients by how we act,
Mm-hmm.
how professional we act when we were at work, when we are at work. Like Joel said, like excellence. Like it's a little bit unfair, but I always think that I am a physical therapist who identifies non-binary, but I also always have this burden to make sure that I provide excellent care because if I don't, then I feel like I'm not representing my tribe. I would say my tribe very well. So
Mm-hmm.
it's a burden for me,
Yeah.
but it's a burden that I bear proudly and gladly. I'm a physical therapist who identify as a non-binary human being, and I want to provide excellent care as much as I can. But the education, all the encounters that we have, that um, we have with patients, with colleagues, these are opportunities to educate them about who we are and what our community means. Because when we educate them and people's eyes are open, then that's the only relationship that need
Great.
these allies in our community.
Feel medyo nag-break ka dun.
Oh, sorry. Did I?
Feeling ko maganda yung sinabi mo.
Oh, sorry.
Kaya ulitin mo.
Na-feel ko yung
Oh my
emotion
goodness.
eh. Kasi pwedeng ulitin.
What part?
Well, colleagues really gets good.
Colleagues? Oh,
Uh,
I don't know. I know where I missed, but I just want to say, like, every encounter that we have with patients and colleagues, we need to use these encounters as opportunities to educate. Um, and if we educate everybody, then that's the only time that we can achieve acceptance in our community. And that's important for us to have rights and privileges as members of LGBTQI community,
mhm,
and make sure that we enshrine these rights and privileges in our existing laws.
mhm. Right, right. So yeah, if you're from the straight community and you have colleagues and friends, try to educate yourself. Ask them what's appropriate, not appropriate. Be conscious on how you interact. So probably doon magsisimula din yun eh. No? Kasi for sure we have friends from the LGBTQIA community. And minsan we try to joke around and stuff like that. Pero um, that may pass na ganun eh kasi we're friends eh, pero dapat we should be sometimes be conscious. Am I crossing the line? Is this not appropriate? If I say this to someone else, masasaktan ba sila? Am I being rude? So probably, dun magsisimula yung education, self-education, self-awareness. And we mentioned APTA kanina. Merong nilabas ang APTA, PT Proud, of a handbook that somewhat introduces the physical therapy professional on some of the terms and statistics about the LGBTQIA. So for those still watching, you can access that. It's a free handbook. It's a I forgot the name, pero you can search that. PT Proud, APTA, LGBTQIA handbook. So it's a parang primer siya on what are the things like the terms, the pronouns, statistics on um, inequalities and social disparities. So you can start there. We can all start there. And gusto ko yung sinabi din ni Jules, like respect and make sure that you honor and use the pronouns that that person is identifying with. Kasi just like our names, you don't want to call someone else with a different name. Tama, no. Mhm.
Yeah.
Yeah. So, as a closing, yung pabaon natin, yung usually closing ko dito sa PT meal eh, yung pabaon natin, kasi PT meal, pabaon, kain. So, yung to go natin for our viewers and listeners, what is that one thing that you want them to take away from our conversation? Yung dadali nila sa practice. Just one thing, very important, that they can carry in their practice after listening to our conversation. Uh, who wants to start?
Pili
I'll
ka na.
start.
Okay,
Pili
sure.
ka.
I guess for me the best takeaway from this session
Mhm.
is that as a professional, learn how to respect other people, regardless if that's about the culture or their gender preference or whatever. Just respect your patient, your colleague. Secondly, also just be yourself. Just be who you are. Don't be afraid what other people would say. Don't be afraid of being judged or being, discriminated. Because let's accept it. You could be a gay person hiding in closet. You would still be discriminated.
Mhm.
They should also be upset with you for
Mhm.
whatever reason. It may not be because of your gender, but for whatever reason, we cannot please everybody. So I'd rather live my life and be happy without pleasing anyone, but showing my excellence with the job that I do. That's all.
All right. Good, good. That's Reg.
I think the takeaway from this one right now is actually centered on respect. Like for our hetero colleagues, yan. And then the younger generation who's going to graduate and you're gonna practice, you are going to meet a lot of people in your practice who are in the spectrum of LGBTQIA+. First of all, never pass on judgment by the way a person looks. Okay, alam ko in the Philippines, we are very notorious for looking at a person and saying bakla or tomboy to. Okay? Please, when you go anywhere else in the world, wag niyong dalhin yun with you. I don't care kung paano ka pinalaki, sino nagpalaki sa'yo. Don't do it. Okay? Don't categorize people into bakla po siya, tomboy po siya, ito po yung pasyente ko. No, respect your patients. And then respect the people you work with. Like, yun nga, sabi ni Jewels, use the pronoun that they want. Diba? I hear this many times in my own practice. They're laughing at the pronouns. Like I have colleagues, it's a shame that you're laughing at the
That's
pronouns
true.
that people want. Gusto niyang tawagin na they, them. Okay, wag mong i-rationalize kung bakit they, them. That's what they want. Respect that. It's really sad that in the year 2022, we still have to have a special edition podcast just to teach people how to respect. Diba? So also, if there are PTs watching in the Philippines, please start somewhere kasi we are very much behind compared to dito sa America. We're all here in America, yung mga kasama ko ngayon in this podcast. But for also those who are practicing in the Philippines, please help us bring it there. Because for every time that someone is homophobic and someone can't come out of the closet, there is a chance that they choke and die in that closet. So yeah.
Ayan. That's good. All right, Phil.
Pabaon, that's hard. I agree with all the statements of Jules and Regina. I'm honored and proud to be on this panel with them, and I'm honored and proud to be with an ally like Johan. At the end of the day, we're all human beings. Let's treat each other as human beings. Let's love one another. At the end of the day, love will always win.
Sure.
Make sure for the people who belong to the LGBTQI community, our fight for inclusion and acceptance does not stop. We're always fighting every day and keep that fire burning. We'll have to fight to make sure our rights are enshrined in laws. So please vote.
All
Thank you.
right. Yeah. So I'm really honored, I guess, as well, and grateful for for you three accepting my invitation and sharing your experiences with us. And syempre, coming from that experience, it parang it really parang nagiging totoo pag if we hear first-hand experiences di ba? Parang kung hindi ka man nakakilala ng ibang ng tao of like a colleague from that are LGBTQIA, at least listening to someone who had that experience, it makes it real and you realize na ito pala yung nararamdaman nila. I should be more kind, be more respectful. Hopefully that
Sorry, if I may add, sorry to cut you off.
sure.
When sometimes because it's difficult for our friends to transition their pronouns from him or he to
Mhm,
he or she,
mhm.
and they would sometimes slip.
Uh-huh.
And then when they slip, they would just make a big deal out of it. Oh, I'm so sorry. I didn't mean to say him. I apologize. I know you. Just don't do that. Just move on.
Uh-huh.
Correct yourself and move on.
Uh-huh.
You don't make a big scene that you
Yeah,
made a
big deal.
mistake
Big
because
deal.
it makes it more awkward.
Uh-huh.
That's all. Sorry to cut you off.
No,
I forgot to mention that. I really want to say that.
Good
So
point.
may mga ganun din eh, no? Yeah.
yeah.
Right. So yeah, so nasaan na ba ako? Yeah,
Sorry.
no, it's okay, it's okay, it's okay. I really enjoyed our conversation. Ang dami ko ring napulot and live from your experiences as well. So I hope this um, conversation continues with other people, other physical therapists in their clinics, in their own practices, and those who are they have their own private practice, they have their own patient set of patients. We can start with ourselves. We can't, hindi na natin kailangan maghintay na from management down. Let's start within the practice, with your department, with you.
Yep.
Kahit hindi siya part ng intake form. Start with you. Start pag narinig ng mga ng ibang therapist yon, then they'll oh, okay, it's cool. Yeah. It makes it normal to do that.
Yeah.
Kasi parang like you've said, parang meron nga talaga tayong colleagues na parang they laugh at the pronouns, the use of the pronouns. Bakit mo magtatawa? It's like a name.
Ba't
That's
ka
how,
nangingialam?
right, diba? So yeah, respect that. That's how people identify. It's like a name. So yeah. So if that's how your patient wants to be identified, respect that. You're here for the best interest of your patient. Okay, not your own interest. You're being selfish. Kung ikaw pa isipin mo, because I only recognize he and she for men and women. No. Pasyente mo yung kaharap mo eh. You're doing this for your patient. So yun lang ang for me, yung takeaway. So isipin mo lagi yung pasyente for the benefit of your patient and and that good rapport and treatment. So yeah, so for those who are watching, listening, and you find value from this conversation, please share it to your colleagues. Para we can educate them and we can start the ball rolling on this conversation again. So until next time, thank you again for watching PT Meal Podcast. So I'm Johan De La Paz. So at nambayanan nyo na yung next episodes. All right. Thank you.
Thank you.
Here.
Thank you.